Outpatient Surgery, what every patient needs to know.
Hello, I'm Dr. Heise, a UW Health colorectal surgeon.
I'm Jen, a medical assistant at the UW Health Digestive Health Center.
And I'm Paula, a nurse at the UW Health Digestive Health Center. We are here to share important information that will help you prepare for a successful surgery.
We'll also answer some common questions and address concerns that many people have about surgery.
At both the UW Hospital Outpatient Surgery Center and the UW Health Ambulatory Procedure Center, you can have surgery and go home the same day. From the time you're admitted to the time that you're discharged to go home, you will stay in one area of the hospital. There is a comfortable area for your family member or friend to wait, which is good to remember because you will need to have someone with you who can drive you home and stay with you overnight.
Having surgery may be stressful, but our team is here to help you through each step of your surgery. You, your family, and your friends are also part of the team that will help you before and after the surgery.
Knowing what to expect is a key part of getting ready for surgery. This video will help you to learn what you need to know before, during, and after your surgery. Let's get started.
Getting ready for surgery. You should have received your medication instructions during one of your clinic visits. Be sure to follow these instructions carefully. A nurse will call you 2 days before your surgery. The nurse will let you know when to arrive at the hospital and where to go on your day of surgery, the Ambulatory Procedure Center or the Outpatient Surgery Center. We will review your procedure time and other instructions with you. If you do not hear from us by 3 p.m., please call 608-263-8803. We can be reached between 9:30 a.m. and 7 p.m. If you have a cold, fever, or illness the day before surgery, please call the doctor's office that scheduled your surgery as soon as you can. We will talk with you about what will happen next based on the severity of your illness. Please leave the following items at home: all of your jewelry, including any body piercings and rings, large sums of money, credit cards, and any other items with personal value.
Bring along your completed power of attorney for healthcare form. Also bring a copy of your insurance card, your driver's license, and a list of your medications and dosages. You don't have to bring the actual medications. Also bring your inhalers if you use one, your CPAP machines if you use one for your breathing problem, your reading glasses, crutches, hearing aids, dentures, prosthesis, or any other special equipment that you will need during the surgery. Be sure these items are labeled with your name or in a labeled container.
You should have received your pre-surgery bathing and showering instructions. Do not use any makeup, lotion, deodorant, creams, perfume, or aftershave, or wear any nail polish on the day of your surgery. It is very important that you follow these instructions prior to coming in for your surgery because it will help reduce your chance of getting an infection. If your surgery requires bowel prep, these instructions should have been given to you either at your clinic visit or over the phone. If you have any questions about this process, please contact one of our Digestive Health Center nurses by calling 608-890-5000.
Arriving for your appointment. When you arrive at UW Hospital and clinics, you may park in the hospital parking ramp or use our free valet parking service. If you use valet, just follow the valet parking signs to the main entrance. Valet parking is open from 5:30 a.m. to 7 p.m. If you park in the visitors ramp, take a ticket when you enter the ramp. Please bring your ticket with you so staff at the information desk can stamp your ticket. You will need this stamped ticket to exit the parking ramp free of charge. If you are going to the Outpatient Surgery Center, enter at the revolving doors marked Clinic Entrance. Once you're inside the lobby, you will see the Outpatient Surgery Center at the first door on your left. If you are going to the Ambulatory Procedure Center, enter at the hospital entrance. Once you're inside, just follow the gray path on the floor and walk past the D elevators. Turn left when you see the sign for the Ambulatory Procedure Center. At both the Outpatient Surgery Center and the Ambulatory Procedure Center, you will find a registration desk. We will verify all of your information and place an ID bracelet on your wrist. This bracelet needs to remain in place until you go home. Getting ready for surgery.
At this time, you'll be escorted to your private prep room. This area has space for 2 family members or friends, so we suggest that children be left at home if possible. A nurse will ask you questions about your health and help you get ready for surgery. For your safety, many staff members who are involved in your care will be checking your ID bracelet frequently to be sure you are receiving care that is appropriate to your needs. You will have an IV started so we can give you medicines such as anesthesia. Members of your healthcare team, as well as a member of your anesthesia staff, will meet with you before your procedure.
You may wish to bring something to read or something else to do while you wait. Family may stay with you until you are taken to the procedure or operating room. You will be taken to the procedure or operating room on a rolling cart, and once you are in the room, you will be asked to move on to a small, narrow bed. A nurse will be with you to answer your questions and explain what is happening. The nurse will stay with you and make sure you are comfortable. You may notice that some staff members are wearing gloves, gowns, goggles, and masks.
At this time, you may have patches placed on your chest. These are used to monitor your heart rate. You will also have a blood pressure cuff placed on your arm or leg, and a plastic clip will be placed on your finger to check your heartbeat and oxygen levels. You may have a soft plastic mask placed over your mouth and nose to give you oxygen to breathe, and medicines will be given through your IV to help make you comfortable. After you are asleep, if you are having general anesthesia, a breathing tube may be placed in your windpipe. Other lines and monitors may be added while you are sleeping.
The amount of time you spend in the operating room depends on the type of surgery you are having. Family members and friends should wait in the waiting area, but if they need to leave the waiting area, they will have a pager so they may be reached if needed. At some point after surgery, your surgeon will speak with your family. This usually happens in your room during your recovery.
Recovering after surgery.
The length of time you will be in the recovery room will depend on the extent of your surgery and the type of anesthesia you received. Your recovery could take 1 hour or longer. During your recovery, nurses will come in frequently to check your blood pressure, pulse, and surgical site. They will ask you how you are feeling and if you're having any pain. If you are cold, tell your nurse. A heating blanket can be used to warm you. You will have things like a tube or a mask by your nose to give you oxygen, wires from patches on your chest to monitor your heart, an IV, a blood pressure cuff on your arm, and inflatable wraps on your legs to prevent blood clots. Some of the equipment in your room will make noises, but our nurses will keep checking on you frequently. Once you're in the recovery room, your nurse will determine when you're ready for visitors. At that time, your family and friends may join you. When you're fully awake, you will be offered something to drink.
Most patients stay 1 to 2 hours in recovery after the surgery is done. You must meet certain requirements before you can go home. These requirements include having your pain under control, making sure you aren't too nauseous, and you will need to be able to get out of bed and walk. At this time, you will receive instructions for your care at home. Your nurse will work with you, your family, the doctors, and others to help you recover. We will review your discharge instructions with you and the person who will be caring for you at home.
Going home.
You will leave the hospital when your doctor and nurses think you are ready to go home. We ask that your friend or relative be present to learn about your care at home. As you get ready to leave the hospital, the nurse will give you supplies if needed. If your doctor orders medicine, you may have the prescriptions filled at the hospital pharmacy before you leave. If you need a follow-up visit with your doctor, we will try to schedule it before you leave. We will provide you with phone numbers so you may speak with someone 24 hours a day if you have any questions or concerns. Our staff will try and contact you the day after surgery with a follow-up phone call. Once you go home, you may feel weak and drowsy for up to 24 hours. Plan to take it easy and rest. Keep in mind this is not a good time to make big decisions or sign legal papers. Also, you may want to eat lightly and follow any specific diet guidelines.
We hope this video helped you feel better prepared for your surgery.